It's Valentine's Day, and that's about love. And I would say, amongst the complementary therapies that I practice, reflexology, reflex zone therapy is my love. I teach a lot of aromatherapy. I've been teaching aromatherapy for postdates pregnancy today at a hospital in London. But reflex zone therapy absolutely fascinates me. And people say, well, this is about feet. I'm not really very keen on feet, but you get past that and you really begin to explore what we mean by using a part of the body to influence other parts of the body. And to a certain extent, there's some similarities with what Amanda was talking about. And in fact, there are some shared points. But reflexology is a very general term. It isn't one thing. There's a whole range of different therapies which can be termed reflexology. So basically, it means using a small part of the body as a map or a chart of the whole thing, and then working with very specific pressure point techniques to influence other areas of the body. And people say, well, how can pressing a point on the toes get you into labor? But actually, there is some evidence that it works. It is very relaxing, but it isn't just foot massage and it isn't just a relaxation therapy. It can be very therapeutic. It can be used to treat a whole range of different elements of pregnancy, birth, and postnatal issues. And we think that it's probably around triggering self-healing, so that basically the therapist, the reflexologist, whether that is a midwife or a practitioner of reflexology, almost acts as a conduit. They act as a facilitator to stir up the body, the self-healing capacity of the individual who's receiving reflexology. Now, when I first started, and that is many, many years ago with reflexology, my son was only about 9 months old. Some of you might have heard this story. And I was still breastfeeding him morning and evening. I was back at work. And then I decided to do what I thought was a general reflexology course, but turned out to be this very specific type, which is a German type of clinical reflexology. And whilst I was on the course, I started producing much more milk again, as if I was third or fourth day postnatal. And that was my light bulb moment, my aha. If this can do this to me, what can it do to other people? And since then, I've been able to use it for a variety of issues amongst a range of expectant mothers. And it's really absolutely fascinating. So, reflex zone therapy, which is the style that I use, is actually slightly different from generic reflexology. So if you have been to have reflexology, um, often it works on de-stressing. We know that it reduces the cortisol stress hormones and increases the endorphins and the enkephalins. But reflex zone therapy is a bit more specific in what it can actually do. It was designed by a midwife, a German midwife, actually. She's still alive. She's about 85 or something, but she's still doing some teaching, strangely. And she's a fabulous lady. And reflex zone therapy is quite popular in Germany and Switzerland, Austria, and parts of Scandinavia. In fact, I believe I'm right in saying that some years ago in Denmark, medical students were given an introduction to reflex zone therapy to start them thinking about the different ways that can be, the way that we can look at the body in a way which is slightly different from conventional healthcare, really. So, how does it work? Well, a short answer is we don't actually really know. We know that it appears to work by pressing on specific points, and it's usually the feet, but it could be the hands. There are styles of reflex treatment which work on the tongue or parts of the back or the ear. But what we believe it is possibly nerve related, so a neurological transfer from all the nerve endings in the feet through the body and then influencing a part of the body that is distal to the feet. We know definitely that using touch will reduce those stress hormones and increase the feel-good hormones, but also, of course, for us, reducing cortisol will increase oxytocin, and so it's a facilitator for a more spontaneous physiological birth. As Amanda was talking about, people do think, well, maybe it's partly the gate control theory, the pain relief issues. And there are some styles of reflexology which work along the very same principles as acupuncture. In fact, there is a point on the base of the foot, on the sole, fairly near the center of the sole, which I would call a reflexology relaxation point, and Amanda would call an acupuncture point called kidney 1. So there are definitely some similarities and some links between acupuncture and reflexology generally. But the points of the rest of the points are quite different. But I think it's also worth remembering that when we're providing massage, we're actually working from the outside inwards. So we're working on the skin and the muscles, and hoping that the effects of massage will again encourage that stress relief and the feel good factors. Reflexology, and particularly reflex zone therapy, is thought to work from the inside out. So it's actually working at a deeper level. The pressure that is used in reflex zone therapy is a great deal more than in massage. And in fact, there's a wide spectrum of pressures that might be used according to what type of reflexology you use and where it comes from. So there's some very, very, very gentle methods of reflexology, which is similar to Bowen technique, which is a very fine movement of fingers and thumbs across the body. But there's also some excruciating types of reflexology. If anybody's ever had a massage on the beach in Thailand, where they really get to grips with you, they're throwing you about and massaging you hard. And there is a Taiwanese style of reflexology called Roshur, which is really, really excruciating. It's lovely when they stop, but it's very, very effective. And I've had it in Japan, actually, when I've been teaching in Japan, and you almost want to jump off the couch, but you feel really good afterwards. And I can't quite explain why that might be, just perhaps because they've stopped, but it is very, very effective. So, what benefits does it bring to us as midwives and for expectant parents who might want to use reflexology or particularly reflex zone therapy during pregnancy or birth or postnatally? Well, I've already said about the reduction in the anxiety, the stress, the fear, and simply having a treatment where you're face to face with the therapist, the person who's providing the treatment, of course, gives an opportunity for the expectant parent to sort of ask questions and talk. There has been research on what people talk about during reflexology, and it's almost as if you're giving them questions they perhaps wouldn't have asked you as a midwife in the antenatal clinic because they know that you're really busy or whatever. It can, of course, be really instrumental in helping with easing pain throughout the whole of the childbearing continuum. But you can use it for very specific physiological and even pathological conditions. It comes into its own with things like gastrointestinal problems. You can treat constipation very simply. You can work on the points of the feet that represent the valve at the top of the stomach so that you can reduce the severity of heartburn. I've done a lot of work around looking at the bones in the feet, which relate to the musculoskeletal system. And I came to a conclusion with some work I did when I was at the University of Greenwich that women with sickness in pregnancy, and I'm not talking hyperemesis, but maybe moderate sickness, there's a trend that many of them have had musculoskeletal problems, such as a whiplash from a car injury, a car accident, or something like that. Or maybe they've had very, very significant dental surgery and jaw impaction and things like that. And those women tend to have more severe sickness than those who have not had these musculoskeletal issues. And so I would use reflex zone therapy, working on the parts of the feet that correspond to the musculoskeletal issues, rather than working on the parts of the feet that relate to the stomach, for example. You know, working on the stomach doesn't necessarily resolve nausea or vomiting. So I've worked with hundreds and hundreds of women. When I was at the University of Greenwich, I had a clinic, which was a weekly clinic and ran for 10 years, where I used primarily reflex zone therapy and a bit of aromatherapy and some other therapies as well. But, you know, it's very, very good for dealing with a wide range of physiological disorders and postnatally as well. But it's also excellent for helping with aiding the onset and progress of labour and dealing with issues that arise during labour, such as retained placenta, you know, a fairly easy little technique, which may make the difference between somebody requiring a manual removal of placenta in theatre. And it's so simple and so quick that it can be done even while they're in the anaesthetic room waiting to go for their manual removal. Little tiny techniques, very quick ones, but they can be very effective. It's also really good in helping with lactation issues, whether that's stimulating or sedating lactation, according to the woman's preference, and generally aiding their progress through from pregnancy to birth and on to the postnatal recovery. I mean, you can use reflexology for babies, where the points, of course, are all much closer together because the feet are tiny. And I've even got, actually, I've got a book on reflexology for cats. So, and there are reflex points on the paws of cats. I have to say, my cat never did like reflexology. He much preferred massage. But you know, and people say, well, what's it all about? It's all a bit weird. How can pressing a point on the toe make the uterus contract? But years of practicing this will show that you know, I can vouch for these sort of things. And I have done research in previously also on the diagnostic side of reflex zone therapy, which I'm very interested in. And if you've ever been for reflexology, practitioners might say, oh, have you ever had such and such? Have you ever experienced, you know, a problem with your knee or something like that? But reflex zone therapy is incredible for being able to tell things about people from their feet. I have to say, I can't do things like predict the lottery numbers or something like that, but I can certainly, you know, tell you which teeth need filling or whether you've got, you know, a problem with your knee or whatever. And I did some research on predicting stages of the menstrual cycle, obviously in non-pregnant women. And from the feet, you can work out which ovary is active during the month and then sort of where they are in the menstrual cycle so that you can also then predict the potential onset of the next menstrual period. And then I've adapted that to give you a bit of a feel for when labour might start, which is really useful when you're looking at postdates pregnancy treatments. And of course, I can't say you're going to go into labour on Thursday at 5 o'clock, but I can give women an idea of, yes, you're nearly ready, or no, I think you've got a bit longer to go. And it's based on the same principles as the research that I did around the menstrual cycle. So just to finish off, a couple of things to show you. In reflex zone therapy, which is slightly different from reflexology, the right foot relates to the right side of the body and the left foot relates to the left side. The top of the foot relates to the front of the body. So I don't know if you can see the cursor here, but where you've got the top of the big toe, this would be the face area. So this is where the zones for the face are. Plus we've also got the next two toes relate to the eye, and the next two toes relate to the ear. And of course, the foot on the other side would be the same. So if there was another foot on this picture, the big toe would be the other half of the face, then 2 toes for the eye, and 2 toes for the ear. And then we have the area at the just below the base of the toes, which is the breast with the nipple sitting in the middle, and then the abdominal musculature. And what is interesting is you can also do reflex zone therapy on the hands. It's a bit more difficult. The points are very much closer together, and the feet are more sensitive to the pressures that you use. But if you think about the hand as the same as the top of the foot, where the knuckles are, that is the zone for the breast area, and it's the same on both hands. There is a theory that if you have an intravenous cannula inserted in labour into the back of the hand, obviously on one hand, it may suppress lactation on that side, because what you're actually doing is sedating the energy zone for the breast on that area. So a little bit of homework for you. Women who have drips in the back of the hand during labour, see if the lactation is worse, not as good on that side as it is on the side which didn't have the drip in. And it would be much better to put the IV needle in the side of the wrist rather than on the front of the top of the hand, or because it's the breast and nipple zone. And then one last point. This is the sole of the foot, the plantar surface of the foot. And there is a relaxation point just underneath. This is the ball of the foot, and this is the dividing line. So in most people, this is the part that is raised from the floor, whereas the ball of the foot and the heel are down on the floor when you're walking. And the arch of the foot actually represents largely the internal organs, and particularly the gastrointestinal tract, the intestines. But just underneath the ball of the foot, there is a point there, which is a relaxation point. And this is the point I was referring to that Amanda would call kidney 1, because it's also an acupuncture point, but it's an acupuncture point which has the same function. It's a relaxing point. I don't think you tend to needle it generally in acupuncture, but it's certainly an acupuncture point, and it does the same thing. And I think it's really interesting, although Chinese reflexology is actually somewhat different from reflex zone therapy or general reflexology, these are simple little techniques that can be learned by midwives or by partners to incorporate into care and nurturing of women particularly during labour, but at other times of the childbearing continuum as well. And I think, obviously there's a lot to learn if you want to learn to use it professionally, but there are just those few little techniques that can be helpful. And it's fascinating because, as I say, it's very different from massage. It may incorporate a few massage techniques, but it works on a different level. And it's really very, very effective. And I've had some astounding results. Even to me, they've been astounding. And, women will often go away from a clinic and say, well, I just feel so much better. I feel really, really good. So I do think reflexology, reflex zone therapy is something which can be incorporated into midwifery. You don't use any oils or creams, so it's not the same as aromatherapy. You can use aromatherapy afterwards, but when you're working with the feet in a reflex manner, you need to be able to grip the feet to do some of the manipulative work. So it isn't just a foot massage, but it is a really sort of beneficial set of techniques that you could incorporate into midwifery practice. And some of the midwives, Amanda was mentioning the midwives, or I think Sue was mentioning the midwives who are licensed to Expectancy to work in private practice. And some of them are using reflex zone therapy in their private practice and having really good results, particularly with something like postdates pregnancy. So thank you, Sue. That's my bit there. Thank you very much.